Welcome to this Protecting Veterinary webinar series on acute diarrhoea in dogs and cats. Diarrhoea is defined as an increase in frequency, fluidity or volume of faeces. In this webinar, we are going to focus on acute diarrhoea. This is diarrhoea which lasts no longer than 2 weeks. Acute diarrhoea is often self-limiting, and many animals would recover without any veterinary intervention, although there are some things we can offer to help them recover faster. So if acute diarrhoea is often self-limiting, why do owners bring their pets to the vet? They may be concerned about their dog or cat's welfare and worry that they could be in discomfort. They may be struggling to manage with the regular outpourings of diarrhoea in their home. Or finally, they may not realise that the diarrhoea is likely to self-resolve and may think that veterinary intervention is essential for their pet's recovery. Given the self-limiting nature of acute diarrhoea, etiology is not always established. However, here are some of the common causes for acute diarrhoea. Eating things they shouldn't has to be one of the most common causes for acute diarrhoea. Whilst we typically think of dogs as scavengers, some cats are also prone to this behavioural trait. Dietary intolerance or hypersensitivity. There are many infectious causes of acute diarrhoea, which we will look at in more detail in a minute. Certain systemic and metabolic diseases may cause acute diarrhoea, such as Addison's and pancreatitis, and other anomalies include obstructions or intussusceptions. Stress and toxin exposure may also cause diarrhoea, and certain medicines, such as antibiotics, may have adverse gastrointestinal effects. There are, of course, some causes which may present initially acutely but go on to become chronic diarrhoea. There are many possible infectious causes for acute diarrhoea. We know that various parasites may be seen in puppies or kittens if they have not received adequate worming, and Giardia is not uncommonly detected at fecal analysis. Then there are many viruses which may cause or contribute to diarrhoea. Perhaps the most feared in the UK is parvovirus type 2, which can cause acute fatal diarrhoea, most commonly in young, unvaccinated dogs. And then there are several bacteria which have the potential to be pathogenic. Though we will see as we progress through this webinar that it's not always easy to ascertain whether the presence of these potentially pathogenic bacteria is definitively the cause of the diarrhoea. Parasite infections tend to be more common in younger animals. If worms or their egg are detected in the stools of a patient with diarrhoea, then treatment should be initiated with an appropriate endoparasiticide. Protozoal infections are often subclinical, though they may cause disease in young or immunocompromised patients, or in those with concurrent infections or other diseases. If protozoa are identified in diarrhoeic patients, then medical management is likely to be required. This could include certain antibiotics. For example, metronidazole may be used in the management of Giardia. This could be used alongside of fenbendazole. Obviously, viral infections cannot be treated using antibiotics. However, there are some situations where viral infections may increase the likelihood that antibiotics are required. For example, viral infections may increase the risk of sepsis by causing immunosuppression or damaging the gastrointestinal epithelium, enabling commensal bacteria to move from the gut lumen into the blood. Of course, if sepsis occurs, then antibiotics would be essential in the management of these patients. So we'll move on to look at bacteria in the stools. We can see here a list of potentially pathogenic bacteria and their prevalence, according to various studies, in the stools of both healthy and diarrhoeic dogs and cats. Whilst they are clearly present in some dogs and cats with diarrhoea, it's particularly important to highlight the high prevalence of potentially pathogenic bacteria in the stools of healthy animals. Studies have shown that stools from healthy dogs were more likely to contain Clostridium difficile and Campylobacter species than stools from animals with diarrhoea. Given that these bacteria may be found in healthy animals, their detection in the faeces of diarrhoeic animals may be coincidental as opposed to causative. For this reason, it can be difficult to determine the clinical significance of pathogenic bacteria isolated from diarrhoeic faeces. If you have watched our webinar on the microbiota, probiotics and prebiotics, you will hopefully remember that a sign of a healthy microbiota is diversity, and this diverse mix of microorganisms often includes some potentially pathogenic bacteria. One study found that while 30% of fecal samples from diarrhoeic patients contained potential pathogens, healthy dogs weren't far behind, with 22% of their fecal samples also containing potential pathogens. We have established that identification of potential pathogens can be difficult to interpret, but actually, fecal culture itself is not enough to even detect these potential pathogens. There are many strains of non-pathogenic E. coli which exist as commensals, and culture of Campylobacter tells us very little without establishing which species is present. Campylobacter absaliensis is the most commonly isolated species. However, this is not thought to be pathogenic in dogs, so is unlikely to warrant treatment with antibiotics. Yes, it is a zoonotic bacteria, but we will come back to this topic shortly. In order to identify potentially pathogenic E. coli and Clostridia species, specific toxins or genes need to be detected. PCR is required for Campylobacter speciation. None of these tests are carried out at routine fecal analysis, again making positive culture results for Campylobacter or E. coli without knowing the species or strain of questionable value in the workup of the case. Since any change in the gastrointestinal environment itself can cause an imbalance in the gut microbes, known as a dysbiosis, increased prevalence of certain bacterial species may be caused by the disease process causing the acute diarrhoea, as opposed to being causative of diarrhoea in the first place. Diagnostic testing is not carried out very commonly in acute diarrhoea, since by definition it will resolve within 2 weeks. One study reported that 16% of patients presenting with diarrhoea had diagnostic tests carried out, of which the most common were bloods including haematology and biochemistry, and fecal parasitology and bacteriology. A more recent study found that 7.8% of dogs and 6.8% of cats presenting with diarrhoea had fecal analysis carried out. Knowing that there are limitations to fecal analysis, particularly with regards to detection of bacteria, what are the benefits of this diagnostic procedure? Well, firstly, if certain pathogens are detected, such as parasites or protozoa, this would most certainly guide our treatment choices. Secondly, some information gained from fecal analysis can provide important prognostic information, for example, detection of type 2 parvovirus. Here are some handy criteria which may help to guide you as to when it could be useful to consider fecal analysis. If an animal develops sudden onset acute hemorrhagic diarrhoea, if there is concern regarding the development of sepsis, for example, deteriorating systemic clinical signs, haematological changes, and/or positive blood culture. If an animal develops diarrhoea after a visit to kennels or a show, though it is worth noting that both of these could cause stress-related diarrhoea, so knowing the animal's character and taking the severity of diarrhoea into account may also be relevant in this scenario. Or if multiple animals in one geographic location or even in one household are affected, or if the owner themselves reports symptoms. If you are interested in reading more on this topic, the material covered in this webinar has been published in the first of a 2-part article which can be found in the June 2020 issue of the journal Veterinary Practice.